experience. He's supporting as consultant in Sri Yoga and Alpha Yoga Laya, Nesapakam. So next, this is Vijay Priya. This is Vijay Priya, yoga therapist, MSc and MPhil in yoga and naturopathy. Can you hear me? Is it okay? In yoga and naturopathy, running a famous yoga center, Alpha Yoga Laya in Nesapakam, and teacher training institute also. Next, Mrs. Vijay Priya Sujata, uh, yoga teacher, Sri Yoga faculty, supporting more than 3 years. I'm truly honored to have them here. So now we will move into the welcome you all for the workshop. Our topic is holistic wellness through yoga and yoga therapy. This means taking care of a person as a whole. It is a complete approach to the health and well-being. As we know, according to WHO, health is the state of complete physical and mental and social well-being. And now, just the absence of disease or infirmity. So, health is the state of present well-being, and wellness is the path towards the good health. So, in this journey, yoga and yoga therapy plays a different role. Yoga is in general practice for overall wellness, and while yoga therapy is a customized approach according to the individual health needs. So next we will explore how we have structured our workshop. We have divided it into three parts. The first part is physical wellness, where you see how both yoga and yoga therapy work together to strengthen your body. The second one, physiological well-being, how it supports your internal system and maintain balance. The third one, the physiological wellness, how yoga and yoga therapy help you to work in your mind and keep it in calm and positive way. Together, these three parts are the pillars and foundation of holistic wellness, give you a complete understanding and unique tools of yoga and yoga therapy. And you will also have very interesting part as a practical session and easy herb tip to follow and add in your day-to-day wellness habits. So now we will move into the workshop. So I welcome you all for the workshop. So the first part, we will move into what is physical well-being. Physical well-being simply means having healthy habits that is free from pain, illness, and able to function well in daily life. It means feeling strong, energetic, and active throughout the day. Are you feeling the same? Can anybody unmute and answer it? Are you feeling the same? Okay. So we will move into how many of them following the physical activity daily? Just give a thumbs up. Walking, jogging, swimming. You can even put it in the chat box. Good. Happy to see. So many hands are raising. Good. Keep going. Jogging, swimming, cycling, and even yoga. Awesome. So you can put it in the chat box. Good. So we are seeing so many hands. Today is the great day to start, even if not yet started. So we will move into the next part, how the yoga will support yoga and yoga therapy approach in the physical well-being. Yoga and yoga therapy promote physical well-being through the following tools. The first important tool is the yogic warm-up. The aim of yogic warm-up is to keep your joints strong and flexible. It will gently prepare your body movements. It will help you to move easily, free from pains, will give comfort and help to prevent from the injuries. So these are the important benefit of the yogic warm up. And the next tool is dynamic posture. Dynamic posture help by building your muscles and bones strong. It will give strength and flexibility and help you to stay fit and also improve your posture. So then third one is sequential yogic posture. So sequential yoga postures are planned in a series to it will be in a certain order. It's done in a flow like standing, lying. Then we will come into the seated. Like that, it will be in a logical sequencing part. This makes the body feel balanced and integrated. So these are the three important tools yoga and yoga therapy approach for the physical well-being. So before we will go into the practice session, we will see. I'm happy to share a war veteran yoga journey, person's yoga journey. Let's watch this inspiring transformation. I think we will go with that. So please ignore it. Oh, what are you doing? You sent me those first two pictures on with the knee braces, the back brace, the canes, 200 and 97 pounds, and his belly was out to here. And I was thinking, God, how am I gonna help that guy? When you get what you want, not what you need. When you feel so tired that you can't sleep. Stuck in that bed. The tears come streaming down your face. When you lose something you can't replace. When you love someone but it goes away. It feel it's real now. It's like I'm hoping something don't fall. It's not gonna do that right now. I'm really pleased with this. And I just want to share this with everybody. Excellent. To your love, let it go. But if you ever try, you'll never know. Get right. What you want. Now we will move into with this inspiration mind. Let's move into the simple chat-based yoga tools. So we will start with the practice session. So everyone can, if possible, can you open the video? I request everyone to switch on your videos, which will be helpful if you practice together with us. So it's a simple thing. You can sit on the chair and do very simple one. You can see on the slide itself. These are the three things we are going to do. So try to, if possible, switch on the video. Okay. Now I request Mrs. Sujata ma'am to help in the demonstration. So we are going to see the modified asana, which will be easy. You can sit on the chair, and even if you're working in workplace, you can do this. So we are going to modify the Utkatasana as a sit stand. So from the chair, you're going to stand up with the breathing. On inhale, stand up. On exhale, slowly you can sit on the chair. So we can repeat this with Sujata ma'am 5 more times. On inhale, slowly lift it up. On exhale, slowly sit on the chair. Inhale up. Exhale down. Hope all are enjoying the practice. Two more. Inhale up and exhale down. One more. Inhale up and exhale. Slowly you can sit. So the sit stand will improve your posture, it will reduce your back pain, it will boost your energy. So you will be standing and sitting while doing this asana. You can your thigh muscle, your gluteus will be engaged, your calf muscle will be engaged. So which will be helpful for your legs. So since we all are working, so you'll be sitting for long seated. So this asana will support to help you in even in your workplace. So try this. Hope you will all try this in your workplace itself. And now we will move on to the next asana, seated third asana. We will go with seated third asana. So interlock your fingers and palms facing downwards and keep it behind your head. And on inhale, slowly raise your arms, the palms facing the ceiling. On exhale, slowly bring it down, palms facing downwards. Inhale, slowly lift up, palms facing upward. Extend your spine. On exhale, slowly bring it downward, back of your head. One more, we will try. Inhale, slowly stretch your arms. Exhale, slowly bring it down, arms facing downwards. One more. Inhale, up. Exhale, down. Slowly bring it down. Relax. So this is the seated Tadasana, modified seated Tadasana, which will immediately instant. It will give an instant relief in your shoulders, in your upper back. It will help to reduce your wrist pain. If you keep working on your system for a long time using mouse, like that, it will be have more day to day life problems, which will reduce, will give the flexibility in your upper back and your shoulders and overall upper body. It will take care of your upper body. So try this asana also. And the third, we will go into the next one, leg stretch on the tap. We will start with left side. On inhale, slowly your leg front, stretch out up to your hip level. On exhale, slowly drop your leg down. Now move it to right side. On inhale, move your leg. On exhale, slowly bring it down. Now we will try both. On inhale, slowly move it up. On exhale, slowly come down. These dynamic postures will give you strength and improve the flexibility and it will give the blood circulation. Keep doing Sujatana. We will continue with inhale left, exhale down, inhale right, exhale down. Now try with both the legs. Inhale up and exhale, slowly bring it down. So this also you can try in your workspace, which will give an instant relief for your leg and which will help you to increase your blood flow in the leg, which will help you for a long seated stress. It will relieve. So it will be easy to do in your workspace. Try this also. I think you hope you enjoyed the physical wellness session. Now I will.
So that's the question that comes from many people's mind that how I'm already an athlete, I'm a walker, I'm a swimmer. Will this physical wellness exercises help me? Anyone who can share any inputs? Yeah, definitely, this exercises will help you to improve your wellness in whatever form of life, physical activity you do. For example, in our yoga center, we get lot of students who have been regular marathon runners, who are sports people playing badminton, tennis. Still, they have some physical issues like tennis elbow, weak knees, hip pain, and all this sort. Definitely, there's always a physiotherapist and a medical doctor to help you, but these are not giving you lasting solutions. So finally, they come to a conclusion: I should not continue with my sports. Whereas yoga and yoga therapy helps you to continue with your own passion of your physical activity and also helps you to get cured or come out of this pain which you suffer physically. For example, the first exercise which you do, sit stand. Madam, can you demonstrate once again? Sit stand. Yeah, this helps you to work in your hip abductors. So hip muscles always go into an injury mode if you are overusing them, or they go to a disuse mode if you are going to work in your life like sitting down and teaching or standing more and teaching. So this helps primarily in working with your hip abductors, helps you to work as Renika said in your gluteus muscles, and also to some extent in your coccyx region. Fine. Now, if you see the second one, which was demonstrated, it may look like a simple stretch out. It is a modified yoga posture. Yoga evolved ancient days. That time there was no video, audio. People were practicing under learned teachers. So this you can see how well she's rotating her wrist joint. She's lowering and rotating her wrist joint and lowering behind her neck and neck region. It is working on her elbows again, once again, stretch more and stretched on. So again, as I said, yoga and yoga therapy can be used both for your disuse mode and overuse mode. In yoga, we call it as ati yoga or ayoga, meaning not using the muscles properly or overusing the muscles and joints. Thank you, Sujata. The last one, which she did, is a sequential yoga part. This reminds me of some other thing which you teach in your Sri Yoga Center. Do you teach Surya Namaskar, Renuka madam? Yes. Tell me about the benefits of Surya Namaskar. So Surya Namaskar we call as a king of sequential asanas. So which will give the dynamic movements in a specific order. So, sorry, do you have a slide which represents that, madam? Can you show to the participants? Because many are good in physical exercise, but very few are good in yoga. Very few people know about Surya Namaskar. Can you just display to them the demonstration of Surya Namaskar in a slide? So, I think previous slides. Previous slides, please. Previous. Pre. Okay. So you can see in this slide, there are so many poses. Can you explain a little comment? What is this? So there is Surya Namaskar will be having 12 steps in a sequence with standing two. Again, we will come back to the starting position. So the first one is stretching the arms backside, and the second from the Namaskar, they are stretching the arms from backside. Then we will go to the forward bend, then Asana, keeping one leg front and keeping the leg back. And the third one, both the legs straight and it will be like a plank pose. And then fourth one is we will be going to the Chaturanga Dandasana. We will go like a push-up pose, which is famous to build your muscles. And then from there, we will expand your chest and move into the Urdhva Mukha, that means wolf pose. And then from there, you'll be going for a dog pose, lifting your back, and you'll be going for a forward bending. And from here, again, you'll be keeping the other leg front, as the Sanjanasana, like half pose. And then again, you'll be coming to forward bend. Then again, arms back as Hasta Uttanasana and come back to Namaskar. Thank you, madam. You explained it very well. Renuka, madam, you have been teaching yoga for kids and women. How do you find when you teach the Surya Namaskar, how is the improvement seen in your yoga center when they learn this? And how much duration this Surya Namaskar takes? So the duration of Surya Namaskar is very less. Easily we can get the benefit in Surya Namaskar. The kids will enjoy to move the different poses immediately, and even the kids will do in advanced Surya Namaskar poses. They will train from here in jumping method, which we will give interesting, and we will give even in the same poses in different advanced yoga. So it will give also the um, for the heart. It will raise your cardio improvement. Thank you. So, thank you. So we have Sujata who's been teaching in schools, yoga for schools, and she's been teaching a lot number of girl students and men students, boy students, this Surya Namaskar. And she always gives us a feedback telling that Surya Namaskar helps the natural growth of the people. It helps the natural people who are born short. Also, with the next generation, they always have a fear that my children are going to be short. If you put them in some physical activity and if you put along with yoga and yoga therapy, definitely height will not be a factor. And also, as the Renuka pointed out, the endurance level of these people performing Surya goes up. They can do any activity. If you do Surya Namaskar for 7 to 10 minutes, they can extend it to any other activity for more than 1 hour. It compensates walking, it compensates running because the heart rate goes up and also settles down fast. Unlike if you go for a long run or a long or a run or a quick run or a marathon run, the heart rate goes up and comes down. It takes a long time to settle down. The resting heart rate takes much longer time. Whereas if you practice Surya Namaskar, the resting heart rate comes back to its original form within few minutes. So I find Surya Namaskar is both beneficial physically and physiologically. Yes, ma'am. Over to you, madam. So now we will go to the next interesting part in physical wellness, the herbs. The herb tip, which you can easily use in your daily life. We stretch our body. Now let's talk about equally important what we eat to make physically strong. So first we are going to give only the two important thing. The herb, it's muringai leaves, which is the
a superfood. It's called as a superfood in the herbs. So mulga leaf contains 7 times more vitamin C. It's 4 times more calcium than the milk. It contains 9 essential amino acids, which is rare from for a plant. It supports your muscle repair and strength. So you can take in a soup form, or you can make it as in a regular cooking method. Also, you can do. And for us, those who are in busy schedule, you can in market you will be getting powder form. So you can use it in warm water and mix it and you can drink, which will be a supportive to help for your muscle strength and bone strength, which will take care of your physical well-being. And the next one is a nut, which is very known for everyone, I think. So badam. So you can soak the badam and you can eat. So you can soak it and bring it in a small box, and you can keep it even in a handbag. So in the break during your work in the break time, you can use easily. So which will help you to manage your support to muscle damage. It will reduce your muscle damage, so which is very important now. So protein is a very important, and the protein which easily you can get with the small amount, so which will be helpful for you. Just you have to soak 4 5 badams, and it will give us energy and prevent sugar spikes and crashes also with this 4 5 badams. So it contains fat and protein and magnesium. So it will give a fast muscle recovery, which is very important. So you can try these two in your daily basis.
Oh, Renuka madam, we have in our faculty Miss Vijay Priya, who is also an naturopath, and I feel like she can also present something about physical wellness through herbs and stuff like that. Can you tell me something more about the physical wellness, which or something other than this? She has said about drumstick. She has said something about badam. Can you add one or two more tips?
Yeah, we can use Preventive also. It is good for the bones and the bone strength. It looks like a bone when you see in the plant. It looks like a bone. So it is good for the rich in fiber. It is good for digestion, and it is a weight management too. So we can have it in we can make it as a toil form, or you know that, or in a powder form.
Kirandai.
Currently.
I think in Hindi they call it Hadjo. Hadjo is the name of the drug which is being promoted by the one of the world's biggest organic herbal exporter from India, the Himalaya company. You all know it well. So their exports is mind-boggling. 10,000 crores per annum of Ayurvedic herbs are being exported from India to all other countries. But you'll be surprised to know China is even surpassing us. It's exporting around 20,000 Ayurvedic herbs from China to other parts of the world. Whereas India, we are just only a small portion of that. So in that, when I examined what is this pirandai, pirandai is called in Tamil, but it's called as Hadjod in Hindi. I know many people who are here attending this program know Hindi well. Had is joint and jod is joining, had is bones joining. So whenever we come across some students who are just recovered from an ankle injury or having some pain in the bone or they have some calcium depression in the body or as Renuka said, some muscle injuries there, we ask them to eat granite either in the form of capsules or in the form of powder, or the best way is how to make use of pirandai in our daily life. So Vijay, you are telling how to cook this pirandai. Is it very difficult to use pirandai in the natural form, or should we do some cooking and use it?
We have to cook and use. Not we can't use in the natural form. It has to be leave that the fiber has to be taken out, and we have to sort it. We have to grind it with some of the coconut and some chilies and make it as a dough and put it in a rice with the ghee, and we have to take it. Then it has to be taken only in a not in a frequent manner, just for weekly thrice we can take.
Thank you. Thank you. Thank you.
So these are the things, valuable things of physical well-being. Now I'll hand over to.
Excuse me,
So yes,
ma'am.
sir.
Excuse me. I have a small doubt, ma'am. This Perandai is also having a itching sensation while you are eating. Is it correct? How much is the advisable quantity to take?
Actually, yeah, when the full ripened blender will be in itchy form, so we have to take as a tender one, and we can add it with ginger and some tamarind, so that the itchiness will come down. And the tender one is we can use the tender one.
So, sir, safely, I advise people to buy some forms of pyridine in the form of a powder. Anai Arvind Herbals supply it very well. Lot of other people are also there. Himalaya company has got pyridine capsules in the name of Adjor. So once if you are going to take it in that form also, it's fine. But again, it can also be homegrown and not used very often. It's not like daily you have to take. Some of my students use pyridine along with little milk and when they have especially a bone fracture. Some who has some calcium loss and bone, what is it, the test says the bones are, you have a osteopenia stage. To use pyramid only on alternate days because it's little hard to digest. The reason is it's little hard to digest. That's why they add ginger. That's why they add little imli or tamarind. They also add little of puri dal to that to make it like a form of a chutney and eat along with the food. Don't try to take piranda in the form of a separately. Do it along with the food.
Thank you, ma'am. Thank you, sir, for the clarification.
Yes.
So, you having any questions regarding this the physical well-being? Okay. So I move to Vijay Priya for the next part.
So, hi friends, I'm Vijay Priya Ganesh Jeevan, a part of the Sri Yoga. Now I think we have given a brief about the physical well-being. Now let's go for physiological well-being. Yeah, now let me explain what is meant by physiological well-being. Physiological well-being deals with the function of the internal organs like heart, lungs, and kidneys. For example, just I've given the three ones. There's so many internal organs are there. And then now, for example, if you are walking in the stairs, you are getting some breathing problem issues, and then it is related to the lungs and heart. And then if you are having a frequent urinary infection, or and then some have the kidney stones, and then some psychologically, physiologically, there are so many problems that you are facing. Then it is not a physiological well-being. If it is all in an intact manner, then we can call it as you are well in physiological well-being. Physically, you'll be very fit, but internally, you'll be having the indigestion problem, irritable bowel syndrome, etc. Now, let's see how yoga and yoga therapy works on the physiological well-being. Yeah, we are handling the three tools for this physiological well-being. First one is a breathing techniques. In yoga, we call it pranayama. And then the second one is static yoga postures. And then the third one is herbal tips. Again, yeah, for even for three things, physical, physiological, and psychological, there will be a different herbs. Now let's first start with I'll share one feedback of the student of Mrs. Renuka. Just you can listen it, then you can have a question on it. Okay, so let's start with the feedback of Mrs. Geeta. She's Mrs. Geeta, and Renuka, one student. She's a part of this. She's a student of the Shri Yoga. Now let's hear her feedback now.
யோகாவினால் நாம் பெற்ற நன்மைகளை தற்போது கூற போகிறேன். It includes from நிறைய ஹெல்த் ப்ராப்ளம்ஸ். ராமன் சார் அவர்கள் உங்கள் தெரப்பி யோகா பண்ணுங்க எல்லாம் சரியாயிடும்னு சொன்னாங்க. உடனே நான் சேர்ந்துட்டு ஆனந்த் சார் வழிகாட்டுல ரேணுகா மேம் டீச்சிங்கும் நான் வந்து தெரப்பி யோகா பண்ணிட்டு இருக்கேன். அதனால எனக்கு இன்னமும் நான் இதுக்கு முன்னாடி எனக்கு யோகா மேல அவ்வளோ நம்பிக்கையோ இதுலோ எதுவும் கிடையாது. ஆனா நான் பெற்ற நன்மைகளை பார்த்து யோகாவுக்கு அடிமையாயிட்டேன். எப்படின்னா ஃபர்ஸ்ட் என்னோட சீனியர் ஐபிஎஸ் தானா குறைஞ்சிருச்சு. ரெண்டாவது எனக்கு 2, 3 வருஷத்துக்கு முன்னாடி சீனியர் மல்டிவைட்டமின் அப்போ பெரிய பெரிய ஹாஸ்பிட்டல்ஸ்ல எல்லாம் உடனே நீ டிரான்ஸ்பிளான்டேஷன் பண்ணணும்னு இருந்தாங்க. நானும் ஓகேன்னு சொல்லிட்டு யோகா பண்ணிட்டு இது பண்ணிட்டேன்னா இப்போ அப்சல்யூட்லி முட்டி வலியே கிடையாது. நீ டிரான்ஸ்பிளான்டேஷனும் பண்ணல ஒன்றும் பண்ணல. எப்படி சரியாச்சுன்னு அவங்களுக்கே தெரியல. தானா சரியாயிடுச்சு. ரெண்டாவது அஹ், மூணாவது எனக்கு ஒரு 2, 3 வருஷத்துக்கு முன்னாடி செஸ்ட் பெயின் வந்தது. ஒரு டாக்டர் கிட்ட போனாலும் உடனே அவங்களுக்கு ஆஞ்சியோபிளாஸ்டி பண்ணணும். 87% பிளாக்கேஜ் இருக்கு அப்படின்னு சொல்லிட்டாங்க. ஓகேன்னு சொல்லிட்டு நானும் அஹ், மூச்சு பயிற்சி பிராணாயாமம் இதெல்லாம் பண்ணிட்டு இருந்தேன். பண்ணிட்டு அப்புறம் போய் ஒரு டவுட்டுக்கு ஆஞ்சியோகிராம் பண்ணதுக்கு ஒரு பிளாக்கேஜும் கிடையாது. அப்சல்யூட்லி நார்மல். ஜஸ்ட் லைட் மெடிசன்ஸ் எடுத்தா போதும்னு சொல்லிட்டாங்க. ஸோ இதெல்லாம் நான் யோகால ஆஹ் பண்ண நன்மைகள். அஹ் இதுக்காக நான் ஸ்ரீ ஆனந்த் சாருக்கும் ஸ்ரீ ரேணுகா மேமுக்கும் நன்றியுரையில் இருக்கிறேன். ஸோ எல்லாரும் யோகா பண்ணி நன்மை அடைய வேண்டுமாறு கேட்டுக்கொள்கிறேன்.
Um, just I want to explain in English what she has spoken in Tamil because many people are there in English here. Actually, she was telling that she is a 77 years old lady. She her first of all she is not interested in doing yoga because as she is 77 she is thinking that yoga would help her. But after counseling with Mr. Dr. Anand and Renuka, she started practicing yoga. After a few months itself, she feel a very big change in her physical and physiologically. So her breathing issue, IBS is reduced. And then the second one is the doctor advised her to take a knee transplantation. The doctor, that too, she cured by herself with yoga therapy. And then the doctor was so astonished and surprised how she uh, is out of the danger. And the third one is she got an 87 percentage of heart block when she was went to angioplasty, and she was not interested in taking the strength. So she started her yoga therapy again with a full faith with Renkaman, and then she got, one thing, a surprise one, that totally 87% has block gone, and she's leading her life with a full faith in yoga therapy. I'm so happy to share this with you all here. And then hope you, if you are hearing all these things, can you share something with the chat? You can chat here so that we can have an interaction with the chat. As if you're not opening your videos or anything doing work, so we are expecting a chat here. Thank you so much. And then now now we'll go for a practice session with related to the physiological well-being. Now I asked Sujata ma'am to demonstrate few asanas for you. You can do in your place itself or you can do at your home now. Now, as I said, we are using the three tools. The first tool is breathing techniques, or as also known as pranayama. Yes. So now let's go for first one. This abdominal breathing. Abdominal breathing increases the lung capacity and oxygenates the body more efficiently. And now we can see the demonstration. First, we can see the demo. I can teach her. She will do it for you, and then you can practice in your place. You have to sit erect in your chair with legs grounded on the floor.
Should a person practicing yoga therapy sit down on the floor, sit in cross leg and practice this, or it can also be seated in a chair and practicing it?
Yeah, they can sit in the chair itself because the one thing there is the spine should be straight. Either they can sit on the floor or cross leg or stretch leg, any pen or chair, wherever they can sit, but the spine should be straight. That's it. The first, we can go for a abdominal breathing technique. Keep one hand on your abdomen and gently close your eyes and feel the breath in your abdomen for a few seconds. You can feel the abdomen is moving in and out, in and out. Now we'll go for deep abdominal breathing. On inhale, the abdomen is expanding out. The diaphragm is pushing the abdomen down so that the abdomen is coming out. On exhale, the abdomen, we are contracting the abdomen so that the diaphragm will go to its original position. It's called diaphragmatic abdominal breathing. Now let's do for 4 more times with Sujatana. Inhale, the abdomen is coming out. On exhale, slowly the abdomen is moving in. Third time, inhale, the abdomen is coming out. On exhale, moving in. 2 more times we can do. Inhale, blow the abdomen out. Exhale, contract your abdomen. But make sure your chest should not raise up and down, must not strain on your chest. Relax. This abdominal breathing you can do at your work area or at your home, but do make sure it must be in an empty stomach.
Madam, I have a doubt. What is the difference between the normal breathing and what you teach in yoga, which you call it as yogic breathing or diaphragmatic breathing or abdominal breathing? We all breathe. We are healthy with breathe. And why you insist on this abdominal breathing?
So actually, the breath what we are having in the normal breath is 15 times per minute. Normal breath. Okay? It won't use the we won't use it the full lungs. So the breath will be very shallow and the oxygenated blood won't reach a main part of the body. So we can gain the energy and we can lose the energy immediately. But this abdominal breathing will help to use the three-fourths of the lungs and then the blood, oxygenated blood circulate each and every cell in our body.
Is there any change in the volumetric capacity of the lungs when you do abdominal breathing?
Yes, it increases.
So I read somewhere, and I feel I also being a research scholar, I've been reading all the journals published across the world. Lot of research has gone into this abdominal breathing technique. Somewhere I found that normally we inhale, exhale around 500 cc, but with abdominal breathing, we inhale and exhale around 3500 cc. That is nearly 6 times more than the normal capacity. Is it true, madam?
Yes, of course, sir. It's true.
Thank you.
Thank you, sir. Yeah. So you can understand the now you can understand the benefits of abdominal breathing. I think so. Yeah. So practice it and enjoy the energy level high. Second one will go for seated twist asana. That is called modified trikonasana.
You are going to demonstrate her first.
Yeah, first you can see a demonstration and then you can practice in your place itself. So now first one is actually she has to sit in the front of the chair. Front of the chair.
Middle of it.
So 1 minute I can I hope you can see her. Both the foot on the ground and she's sitting in the mid of the chair and keeping the hands on the thighs. Now she's first one. Yeah, this is as we said We are going to do in a static poses, not in a dynamic way. We are going to stay there for 5 minutes. So slowly she's turning to the left side of the chair and then she's holding the chair there. One both they you can do this side now so that you can see. You see how she is twisting the upper body without moving the lower body and turning your spine. She's holding there. I think all can do this now. And come to the center, then on. All together. Now on inhale in this posture, do this abdominal breathing. On exhale, turn your body to the side, left side. Gently close your eyes. Then we are going to stay in this posture for 5 breaths. On inhale, load the abdomen as we did in the abdominal breathing. On exhale, just contract your abdomen. 2. Inhale, bloat the abdomen. Exhale, contract the abdomen. One more breath. Inhale, and then exhale, contract your abdomen. Center. So you can do this 5 breaths by your own. Now you can do for opposite side, right side. The same procedure on the opposite side. Just close your eyes. You are going to do by yourself with applying this abdominal breathing. What we learned: 1, 2. Take the second breath. 3. Third breath. And slowly come to the center. So you can do this with a minimum 3 breaths to maximum 6 to 7 breaths by your capacity. Now let's go for
What are the benefits of this?
the benefits of this is to stimulate and detoxify the liver, spleen, and pancreas, and promoting the digestive health and organ function.
Madam, I understand when you tell all these things. I'm very tempted, but I'm a lazy guy. I don't want to do any yoga postures. So I don't. Is it okay? I can pop up some pills and come out of the problem, or doing any yoga. What is the difference when you say it's got a lot of therapeutic benefits on liver, spleen, pancreas, etc.?
Actually, when you take the pills, it will work only in the liver again, and then it will give some side effects. But when you do yoga, it will work in a liver, spleen, and pancreas, the internal organs, as well as in your mind level. So the healing will be very fast without any side effects.
Thank you very
Just
much.
it will take few minutes to do that.
Okay. Now, some of the participants here are very young in age. They always keen not only to do it in a modified way. If can you help me to demonstrate a classical trikonasana? You call this as modified trikonasana. So can you ask your student to demonstrate a classical way of doing trikonasana?
Yes, sure, sir, we can do it. Take the share away, and then we can first all the standing asanas, the legs to be gathered. Now spread the legs to 2 to 3 feet apart according to your balance capacity. Now on step 1, raise both the arms by the shoulder level. And step 2, bend forward and twist your whole body to the left side. Twisting. And then look up your thumb finger up. Those who are having the shoulder pain can keep your hands at your back and look down. Keep your hands at your back and look down. On inhale, again come to the center. You can repeat the same on the opposite side. Bend forward, twist your whole body to the opposite side. Now inhale, again come to the center. And exhale, you can drop your hands down. This is in a dynamic way. If you want to stay there, the static posture, you can stay there for 5 minutes.
Thank you, madam. This reminds me of my research work with MV Mohan Diabetes Center in Roypeta, Chennai. India is seen as the diabetic capital of the world, and Chennai and Tamil Nadu seems to be the capital of India in sense of diabetic population. We have numerous a number of medical shops across the street. In one street, we have two medical shops, allopathy medical shops, dishing out medicines. So in this MD Diabetes Center, a lot of research was done on the efficacy of yoga therapeutic solutions in type 2 diabetes. And you'll be surprised, madam, this Trikonasana was found among the asanas, which are very, very helpful in stimulating your beta cells in your pancreas to secrete insulin, reduce the insulin resistance in the cells. This particular yoga posture was very, very found effective, madam, and I'm thanking you. You are sharing this classical way of doing. So sometimes when people are old and they are lazy, they don't have time to do a classical asana. You can always practice this in this way. Yeah, there's a question from one of the spectators. India is not applicable, it is China. Thank you, sir. Because of the number of population, maybe the number of diabetic per population, India can still lead than China, sir. Thank you for this input, sir. Thank you. Then we go to the next question, madam. Yeah.
Then the next posture we can learn is forward bending posture. It's also known as modified Padahastasana. Let's first see the demo. She's sitting on the chair with the hands on the knees and slowly bending forward and trying to touch the floor with the head down, the head facing the knees. And then slowly she's coming up. Now we go for static postures. We are going to stay there. Just told the how this work. Now we go for static posture. Inhale in this posture, abdominal breathing, and exhale. Just contract your abdomen and bend down. Just loosen your body, loosen your head, and we are going to stay there for 5 minutes. One, take abdominal breathing. Inhale, bloat your abdomen, and exhale, contract your abdomen. Two, kindly apply the abdominal breathing. Three, four, and on inhale, slowly come up, and exhale, relax. So this will stimulate the bladder and heart. It will promote the urinary health and also the cardiovascular function. Now let's
Okay, here, then I ask for a question.
So many ladies are having the issues of controlling the urine is a big problem for us. The leakage of urine will be there. So how you will help this asana will support them, na?
actually the it will work in the directly in the urinary bladder. So the static posture will improve the strength in the core muscle as well as the internal organs that urinary bladder. It will work deeply inside the urinary bladder when you do with the abdominal breathing. So
I think there's one more posture which I have seen in our Hyundai Yoga Center in Srinagar where with a lot of women coming. There's a problem in controlling the splinter, the urinary splinter which opens and closes because of aging, because of pregnancy, childbirth, because of various other reasons. Sometimes the splinter, even because of the nerve control over the splinter, there is a urinary incontinence. Is that what you call urinary incontinence? Where there's a what age group it happens? Age group? Oh,
So after 40 plus, they are getting these issues.
okay.
Even during the sneezing, they will be having the leakage and
Okay.
cough like that.
Okay. Oh.
We are facing many students are facing these problems.
They come to you for this. What is, I know yoga and yoga therapy is holistic. In fact, the seminar is holistic health, but still some postures work exclusive. Like I said, for diabetic, the insulin resistance and the things, this trikonasana seems to work better than other asanas. Is there any one particular posture which you can share with this August group? Nearly 70 people are attending here. A lot of women are attending here. Is there any one particular posture that can help you in this urinary incontinence?
So easily we can help this. So we can do one seated asanas, which is we call as well known butterfly pose. Sit down Bend your legs, join both the sole of the feet. So hold your feet. Now slowly take your spine down, lengthen your spine, chin down, tuck your chin in. So without flapping the thighs, you have to do in the static position. No need to flap your thigh. So now you can focus on the abdominal breathing, which will be connected to your pelvic floor muscle. While doing the abdominal breathing, it will strengthen your pelvic floor muscle, which supports your pelvic floor muscle to keep it strong and help to give the strength.
The sprinters.
Sprinter.
Okay, thank you, thank you. So what is this called? In common terms, you can tell what is the name of this yoga?
Bhadragonasana,
In common terms, what do you call?
butterfly pose, common term.
Thank you.
Asana is Bhadragonasana.
Baddha Konasana, butterfly pose. Thank you, madam. Thank you. Also, I have heard some people who talk about herbs, and we have a naturopath here who done our post-graduation naturopath and counseling many people on health things. Is there any particular nut or thing which helps in neurological issues, especially for women's nut? So,
Yeah, we can, the pista is an amazing nut which is helpful for the urinary tract health. Actually, personally, I used to feel this pista in my life. Whenever I have an urinary infection or somewhere we are going out, we are using the restrooms out, so that frequent urination we are facing that. So the continuous eating of this pista daily or 5 to 6 pista will help to strengthen the urinary tract muscle. And then it is by pista will support the heart health by reducing the cholesterol level and providing the it is rich in vitamin E and magnesium. And the next one is we'll talk about the Ponamini Gire. Many people have heard about this Ponamini Gire. It is good for liver. So those who are having the liver problem, now we have fatty liver. We are so many people nowadays are facing the fatty livers, right? This Ponamini Gire will help to in fatty liver and it will boost the immunity and because it is rich in antioxidant and nutrient content. How to use this? So just take 2 grams of Konangani Kirai and then mix with the hot water or coconut water or juice or any curd, that is buttermilk, and have it once a day. You can use this for just 1.5 to 2 months, then see how the difference yours. The Ponangani Kirai is the only Kirai recommended by the doctors for the fatty liver. Thank you so much.
oh, very good. Madam, this Ponagani Devi, does it have gold? Ponagani means in Tamil, it's got gold. Does it have any gold in that? No.
Actually, no, but the value is good.
In your experience, do you know any other herbs that helps in physiological well-being? Like, for example, in heart health, I don't know, do you have any suggestions what herbs or what nuts can be useful in heart health?
Oh, I'm not.
Not that bad. Okay, thank you.
Very
Thank you for being truthful, madam. So, friends, you know about heart health. This is all being about physiological well-being. So, sometimes ago, we had a student who had come from Australia. He, an Indian. So, he had a peculiar problem which the Australian doctors couldn't treat it. He had a missed heartbeat. My God, when I say this, Indian doctors laugh at me. It's a very, very common thing in India where 1 in 10 usually have a missed heartbeat, meaning your heart has to beat for every 72 beats per minute or 60. It varies between 60 to 90. It's okay if it goes even 100 sometimes. So, friends, people across Asia usually have missed heartbeats, whereas the people in the other parts of the world have not heard about, not treated this missed heartbeat. So this guy Indian who was there in Australia, the doctor said, we don't know how to treat this. So way back in India, So he came to Albert's doctor. So doctors were telling your condition is called BPD, specific pain. The rhythm is changing. The sinoarterial node is pulsating like this, that. All these questions were put on him. They did a lot of electrocardiogram study and they did a lot of electrophysiological studies. So, and finally, they came to a conclusion you need not be put on any device, you don't need any medicines, you have to only practice yoga to reduce your internal stress. So, he came to us, he started giving some yoga postures as our Vijay madam was telling, we were given some asanas according to his age, according to his constitution. But more good results came when I suggested to him to eat the betel leaves. Amazing, amazing effects of betel leaves. It has been part of our tradition, but sometimes in the middle of the tradition we lost the betel leaf therapeutic benefits. We started using tuna, we started using tobacco, we started using the betel nuts. All these complicated things and led to more of other problems like oral cancer and gastric cancers, etc. So, friends, simply eating two betel leaves a day with an arrhythmic heart condition where the heartbeat is not regular or it's showing some signs of rise and low helps you to stabilize your heartbeat. It works like a beta blocker medicine. So all our findings says try to anyone, any Indian above age of 40, 45, please have the habit of eating or chewing two betel leaves per day after your lunch. Okay, Renata madam, you can use it in your center also. It helps a lot.
Thank you, sir. Thank you. Now we will go for the next part, the third part, what is physiological well-being. So I hand over to Dr. Anand.
Thank you, madam. You are giving me the last part of the today's session. So, how many minutes I have? 15 minutes, definitely. So, I have my friend here, a student of yoga and yoga therapy, Ashwin, who is going to demonstrate to me certain techniques and techniques. We all know about mind, we all know about psychological well being. So, as I just go with the rules of the presentation. So, what is psychological well being? It's about feeling good mentally, emotionally, managing stress and having a positive outlook on life. I think we have to underline the last word, having a positive outlook on life. So whenever Napoleon, the great King Napoleon, tried to attack a country, he always used to feel that I already won the war. So that was the outlook he had whenever he was going through a stressful phase of fighting a war or losing a war or getting his own men killed or something. Sometimes I see in many of these exams preparation which many students go, I have seen even professional people, many professors are here, many lecturers are there, lot of examination process, certification process are there. Who is winning? If you see, the one who's always felt I have already won, I need to just do certain small things to make that winning happening. So definitely, friends, the simple tip for physiological well-being is to have an positive outlook on life. So now we go to some basic questions on what is mind, what is brain. So all lot of arguments have been done in this many of these forums. Many research papers have been presented on mind, consciousness, everywhere. So according to yoga, mind is everywhere. So if you ask me where is your mind, it's just not brain. Many people point to their head and say my mind is there. Sorry, mind is everywhere. Mind is also very eventually directly linked to your brain. So sometimes yoga and yoga therapy recognizes this fact of connection between the mind and the body very well and tries to use some postures to work on the psychological well-being. For example, I'm asking my very great student, Ashwin, when you get angry, what do you do with your body?
I
Talk a lot.
can't find a way to vent out the anger.
Yeah.
It can be as moving away from the situation, or sometimes at the extremes may involve breaking something.
Yeah, breaking something. So rightfully, it fills all the classical symptoms of stress. Either you fight, you freeze, or you run.
Freeze.
There's a fight, freeze, or run. So whatever it is, the blood flows to the extremes. So when a lot of blood flows to your vocal cord, you start shouting when you are angry, using abusive words. You use a lot of your fingers and hands, try to bang something, throw things, And the end of it, as he said, sometimes it's going beyond our control. We just walk away or run away from the situation. So yoga recognizes all these things happens when you're in a bad mood, for example, anger, and it's trying to make this blood flow in your physiological body more at other times when you're not in a bad mood. For example, when you're in a good mood, if you do some yoga postures, it's like Sutta Vajrasana, or you do an Vajrasana with a forward bending, lot of blood flow will happen to your vocal cords, lot of blood flow will happen to your arms. So naturally, your stress capacity is increased. So whenever an anger mood attacks you, or you are victim of an anger mood, your blood flow will not abnormally rise to the vocal cords or your arms or legs. So there's no fight, no freeze, no vocalization of this. Thank you, Ashwin. So, friends, we have understood there's a deep connect between the body and the emotions, the body and the breath. And yoga uses a lot of technique. There are not few techniques. There are many techniques. Yoga has got a long tradition using multiple techniques to solve many issues. And here in this workshop mode, I would have been more happy if many people had opened their cameras and demonstrated and being part of the faculty. We have pulled nearly 4 to 5 eminent people in Chennai to do all this presentation. Not one camera is being open, is that's the sad part. But still, let's go on with this. So, yeah, as you can see the presentation, a cooling breathing exercise called as Shitali Pranayama will be taught to you in this technique, this session. A relaxation technique with mudras. Mudras are some gestures with using fingers. And finally, as a humming bee sound called Brahmari meditation, which will also be demonstrated and we will also be asked to do. So let's start with this cooling breathing exercise. Or shall we work on that video, madam? Something I think Vijay Priya was very keen on sharing. She often goes to US. She does a lot of yoga classes in US. She does very presentations in US. So she was very keen in showing a video by Mayo Clinic. What is this unique of Mayo Clinic, Ashwin? You have been in US. You have been practicing and studying in US. What is this Mayo Clinic?
Is a clinic for people to. It is an outreach program, basically, to teach yoga more accessible to people from other countries, especially in the US, where it is almost stress.
Thank you. So Vijay Priya was keen on using this video for educating all our 70 members who are attending this program. Please on the program.
Stress, anxiety, and a lack of sleep are problems that many people deal with every day, but there is one simple practice that can help: meditation. Physically, people find they have improved mood, they sleep better, and better memory and concentration. Maria Caselli, a group fitness instructor at Mayo Clinic, says the benefits of just a few minutes of meditation a day can help, especially with stress. Meditation, which is a practice of focus, concentration, bringing yourself back to the moment over and over again, actually addresses stress, whether positive or negative. Meditation can also reduce the areas of anxiety, chronic pain, depression, heart disease, and high blood pressure. The heart rate drops, your respiratory rate drops. There's decreased oxygen consumption, decreased carbon dioxide expired. The body is healing itself and starting repair. Meditation can help us be less reactive and more responsive to events in our life. For the Mayo Clinic News Network, I'm Vivi.
Friends, that was very interesting. So Mayo Clinic,
Less reactive and more responsive.
that's a medical school which was started in 1864. They are employing around 5,000 researchers throughout the world. They have centers throughout the world. One was recently opened in London also. So they have done a lot of research in yoga and yoga therapy and meditation. And that's a thank you, Vijay Priya madam, for asking me to share this for a clip on meditation. So, friends, let's try to learn. Ashwin, can you help me in demonstration of this T3 pranayama? So, how does we can do? So, one first part, please observe Ashwin doing this T3 pranayama, and let's all try doing it. Okay. So, he's sitting straight Yoga does not require to sit down or sit in a Padmasana or the lotus pose. All you need to keep the spine straight, is sitting straight, his foot is rested, is relaxed. Okay. Now see, it's containing, I think, few. I think it's good. You have been practicing steadily. Why don't you teach them and also demonstrate along with it?
Shikti pranayama involves yes. First, you need to roll your tongue like this and inhale through your mouth and exhale. So the process is as it goes. And breathe out. And it is important that we close our eyes when we do this.
So amazing, amazing, Ashwin. You have coupled what Vijay Priya Madam was teaching, the abdominal breathing with this Sitali breathing technique. You are inhaling through the mouth, you're closing your mouth as a step two, and a step three, you're slowly exhaling through the nostril. I think the exhale slowing is the key for all psychological and physiological wellness. It reduces the heart rate, it brings down your reactive rate time to much higher things. Amazing, amazing. So let's all give a good clap to Ashwin for demonstrating this. Thank you, Ashwin. Okay. Now, we have a second technique which helps in your psychological wellness. It's called as a reverse counting technique with mudra. Ashwin, can you show to the participants this mudra of Udana Mudra? There are many mudras. Udana Mudra is what I choose for this group of enlightened people. Yeah. Udana Mudra. How do you demonstrate Udana Mudra?
Black mudra is you use all your four fingers except your pinky, both your hands, and place it on your lap and do your breathing. It involves normal breathing in and breathing out.
Do we count at the end of the exhale mentally?
Yes, mentally the count is one, two, three. And inhale, one, two, three.
Beautiful. Thank you, Ashwin. You have demonstrated well. I hope the audience will also appreciate this technique of reverse counting with this Udhan Mudra. Udhan Mudra, as you understood, is joining all the fingers except the little fingers. We are clueless how this mudra works on the mind and emotions. Definitely, in my practice sessions, I found a lot of feedbacks which says about their mood gets uplifted. Someone is coming with a depressive mind, someone feels low, someone is not happy with the situation around them. If you practice this Udana Mudra, definitely the mind goes to an elevation. So, friends, whenever you also feel little low, little depressed, you can come to anyone. Okay, try this Udana Mudra reverse counting technique. Sometimes psychological wellness is measured by the quality of the sleep. Many people nowadays in cities, in Chennai and other places also are reporting we are not able to sleep for more than 4 or 5 hours a day. Gadgets are being used more, TV shows have been used more, long phone calls, working with different time zones. All this affects both the quality and quantity of the sleep. My simple suggestion is this simple technique of Udan Mudra or just doing the reverse counting, lying down in your bed, just close your eyes, just try to inhale, exhale, count in the reverse order 25, 24, 23. It's a proven technique that helps you. In yoga, we call it as a pratyahara technique, the focus on the breath and counting the breath. So, friends, we are moving slowly to the third technique called as a Brahmari pranayama or Brahmari meditation, using sounds to achieve certain clarity in the thought process. Many of us are also victims of negative thoughts. Definitely, you all will agree with me. If a guy in our team or a girl in our team comes with a negative thought, you can definitely sense it. We all have a deep mind which would always say there is going to be a negative issue around here. So that sort of anticipation we all carry. So how to move this, how to remove this negative thoughts or reduce the negative thought is what I'm trying to help you through Brahmi Pramana. Ashwin, can you explain to them where I go to the chat box and find out?
So Brahmi Pranayama is done, it's a simple pranayama where you hum like a bee. So the first cross is to close your ears with your index fingers and you breathe in. And when you breathe out, you do a M sound. Mm. Again, breathe in and breathe out with an M sound. Mm. Depending on your breath and your practice, you can increase the M sound from 5 seconds to 10, 20 even.
Okay.
It reduces your anxiety, increases your attention, and gives you mental clarity.
Thank you very much, Ashwin, for teaching this whole people this. You have been practicing all this for how many years? You have been practicing yoga therapy under Vedika Madam
We have been practicing it for past 2 years.
past 2 years. What benefits do you find in your psychological wellness?
I have seen my anxiety levels reduce drastically and noticeably. My sleeps have improved. I feel more calm under stressful situations, and I've been able to um, process anxiety much better when I was before my yoga session.
So, friends, that's a very good, a very honest output from Ashwin, who's been practicing diligently. So he came back from US because of the Trump effect, and we all know the Trump effect has played havoc with a lot of people where their visa is not extended or something. This caused a lot of anxiety. I think we can share these details with the group. Thank you.
Yes,
Yeah,
because
a lot of
it is a stressful situation for people in the US that
yeah.
the upcoming the president of there who says that immigration should be contained. And a lot of my friends, my colleagues have expressed their issues that they have families there who is now left in limbo because of this. Uh,
So, very good. Like anxiety is also seen from the anticipatory mode, where it can be a part of an imagination or not understood properly the situation. And in all these cases, yoga and yoga therapy helps. As we have seen that yoga is mostly generalized, but yoga therapy is very specific. We consulted within our group of teachers what could be the best way for Ashwin to come out of his situation. We found that some of the experiences, the techniques which we are sharing here, have been very, very useful for him, and we thought we should also share with this group. So, unlike other exercises, like where you have to do for many number of times and very consistently, you need to practice. All that rule does not apply to yoga therapy. So people come with a short problem, they practice for a few months maximum, and they just get out of the problem, stop your practice. It's something like that. So apart from this sort of techniques in yoga, where we use mudras, where we use this sort of breathing techniques, which works on the physiological level and blood flow, if we work on something on the mind waves, like using the Brahmari sounds, etc. We also in Krishnamacharya yoga tradition talk about ahara or the herbs which might help in uh, in improving your psychological wellness. So in psychological wellness, two specific things I was trying to tell. One is how to take this walnut. You can see the walnut shape also looks like your brain somewhere. It looks like your right brain, left brain, something. Some similarity is there. We don't know. But all I could tell, because many scholars are here, this program, they can also do a lot of research on what does this walnut contains. It contains a lot of omega-3 fatty acids, which reduces a lot of free radicals. Antioxidant effect is there. So this plaques and all this stuff doesn't get formed in your brain. Many things happens in the brain that also influence your mind and emotions. So eating walnut at least twice or thrice a week, 2 to 3 pieces. Again, all the nuts can be soaked overnight and the skin can be removed and just eaten with that. That helps a lot. So that can be tried well with the walnuts for your psychological wellness. Also, we have Manduka Pani, that's called Vallare. I remember very well that this Manduka Pani or this Vallare is very, very effective in improving your memory. One sign of cognitive decline is just losing the names, losing the items when you're working. Nowadays, it happens at the age of 35, 40, 45. What used to happen above 70 is now happening around 30 and 35. People just forget their names. They are very fast. They just have memory gaps. They have cognitive gaps. There's a cognitive decline. So this all can be corrected using this Vallare, which enhances memory, reduces your stress, working stress, and also it gives you a lot of mental clarity and focus. So all this has been done with a lot of research. It's not gone are the days when people in allopathy and medical sciences used to discard yoga and yoga therapy as just a placebo effect and stuff. Lot of double-blind trials have been conducted in all these fields using yoga postures, using breath, using all these herbs, how it enhances. Lot of things have been published. Only thing, the sad part, we Indians are not acknowledging this, which has come from our own country. So let's. I'm very happy that your institution has recommended yoga and yoga therapy to be included in part of your whatever the training you are undergoing. So let it help in improving your quality of life. Maybe some of these tips are useful to every one of you. Maybe some tips may be useful to your families and friends. Definitely, it's not going to be a waste. So I think I have summarized all the things in psychological wellness. We learned a beautiful breathing technique called as Sitali Pranayama that helps you to reduce agitations in the mind. We learned a mudra that helps you to promote good sleep and long quality and quantity of sleep. We also learned a Brahmi meditation using the humming sound, which helps you to reduce your negative thoughts that keeps get cluttered and coming to you often. So this all helps you in that. Also, we revised and got two more herbs for psychological wellness. If you have any doubts with it, yeah, which since the audience are not very talkative, I want you people to talk about this psychological wellness. We we spoke about Ballare, we spoke about walnuts. Any questions are there from our own group?
Excuse me, sir.
Yes, sir, please, sir.
I have a few common queries which are not related to today's topic. And when we are having our own traditional strategy, why people are not opting for yoga as they are opting for gym? Because both are being practiced by the literate community only, and layman he is not bothering about both things. When literate people they are opting more gym rather than yoga, is it due to lack of awareness or lack of credibility? What do you think?
You are asking a question why educated people are more. See, the gym is very quick. Like, for example, I want to improve my physical strength. Someone comments, hey, you look very skinny. I need to improve my physical strength. So, if the choice is between for me to either to go to yoga to improve my physical strength or to go to gym, I will also prefer gym. You know why? Because it's quick research. The results come quick in a gym than in yoga.
Oh.
You got it, sir?
Yeah, yeah, okay, sir. Then another question is there any evidence or is there any data in which the yoga has good, I mean, positive effect on acute or like the disease like cancer and diabetes? Like, is there any evidence or is there any data or is there any case which have in which this yoga has good impact on those cases?
Lot of research has been done. Lot of research has been done in Telangana and Andhra Pradesh regarding that. A lot of publications are there online. Okay, so lot of yoga poses individually has been experimented and tried tried and found efficacies. A lot of publications have also come. It's all available in the net. Yes, sir. But
Yeah.
what is the more thing is nowadays the modern world also recognize in diabetic management it's just not enough you walk or you
Yeah.
just take tablet or follow a diet plan. They are
Yeah.
also now allopathists in Chennai at least are now telling people try yoga, try the herb parts also along with your allopathic medication. This is what we see the ground level. Okay, sir? So
That's
research
right.
is being there, research is also available, but again when it comes like the Ayush has now being very positive in these things, and now every medical college has been appointed with a yoga teacher and a yoga therapist. Every
Oh,
medical
that's
college
good.
in India has to have a yoga therapist and a yoga therapist, especially in Jitma. You must have heard the Jitma in
Yeah.
Pondicherry and Jitma in Chandigarh. They all have most of the physiological conditions like high BP. Instead of putting them in a tablet, the doctors there are themselves teaching a breathing exercise which helps you to reduce your BP. Same way with diabetologists, where they are advising them to do some yoga asana sessions. Yoga is just not asanas. Asana sessions to improve the secretion in that also. So it's all being happening, but not happening in a mass scale, not
Yeah.
happening
Yeah.
district,
Yeah. That's
not
okay.
happening in the primary healthcare level. Unlike
Yes.
like Mayo Clinic in US is very profound in all these things because that's the final stage in the tertiary care, even in cancer, even in all mind-related issues. So there it's being accepted, it's being implemented. Whereas in India, it's still only in few central government institutions. Yeah, regarding the questions on cancer, like,
Yes.
Patanjali, Ayurved, those people have done a lot of research and published also papers on that. Again, the issue is like there's a lot of controversy in cancer management because it's a very broad-based term. Cancer can be in the beginning stage, or it's in the middle stage, or in
Yes.
the
Yes.
in the end stage. So the efficacy has to be seen and monitored and come to a conclusion. But definitely even anyone, even with the cancer, I would always suggest if you practice some yoga, it helps
Yeah.
in even improvement of it's only seen as an adjuvant therapy, not as
Yes.
a
Yes.
standalone alternate therapy.
Yeah.
Yoga and yoga therapy is seen as an adjuvant to whatever treatment they undergo, either in your, for example, I was a part of the research in breast cancer. So
Yes.
here we found that yoga helps them to get a good sleep, helps them to improve their what to say, the stiffness in the chest region. So like this, it helps them to remove their fatigues. In 20 parameters, which I was a part of the study, it was a multi-centric trial which we did. So we found it effective in at least in 12, and 8 the number of subjects was less. So in 12 this has been published, and you can also go through that breast cancer and yoga therapy. So all
Yes.
these are being done, but not being practiced in the ground level. This is what I am
Yes.
trying.
Yes. 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 Uh, Thank you for nice explanation, sir. I have
Thank you.
one final query. Do
Okay.
you suggest any special type of yoga for physically challenged people? Because these type of yoga can be followed only normal people like us. But what about physically challenged people?
Yeah, that is why the yoga therapy comes into role, sir. Okay. So yoga what is the difference between yoga and yoga therapy, Vijay Priya? Explain this up.
Yoga is the classical way of doing the for physical people, but for yoga therapy is the customized yoga,
Yeah.
which has to be given according to the needs of the people.
Yeah. Okay.
For ailments like BP, sugar, and communicable and non-communicable disease like.
Yeah, thank you. So, sir, that is physically and mentally challenged people also can practice yoga therapy. So that's the straight answer. So recently in Sri Yoga Center, Renaba was treating a person with cerebral ataxia. What is the experience of cerebral ataxia person? Please tell me. She had a girl, 9 years old. She got this issue, and she came from the south, from the village part only. They even don't know about the yoga. But with the relatives' knowledge, they came. We are surprised. The doctor has said there is no way to walk properly. It's like a genetical issue. But with the support of within 2 weeks, she started to stand stable.
Oh, that's
So
nice.
we are wondering with the
things because in 9 year girl can't walk means it's a big problem. There is a girl child, big problem for her and it's a parent. So
Yes, yes.
they are continuously doing in the online from the village. Now she started to walk stably. Uh,
So the Niman's doctor in Bangalore are surprised how yoga therapy can work, which a physiotherapy cannot. So that's the
Oh,
difference between
okay, okay,
physiotherapy
okay.
and yoga therapy, sir. Okay, sir.
Yes, yes.
We try to do it in a holistic way, understanding the. We don't call the people as patients. We call them as students. They are yoga students, and it's customized to them. That's what I'm trying to tell you, sir. Okay. So suppose we have like I've been experienced in teaching for blind people yoga, right? There's a blind college in Chennai, down normally 25 kilometers from Chennai. There's a blind school. It's got all the inmates blind, and I've been teaching yoga for them for 2 years. So it's possible. It's customized. It's made to that mold and made them to do this. Not only yoga postures, breathing techniques, the herbal sort of things, the mudras, the meditation, the relaxation. So the key is how to make it sustainable and it should be customized to that group need. Or if you have a physically disabled people with polio, we can do it. With multiple disabilities, we can still do it. Okay. So according to our traditional teacher, the Krishnamacharya, if one can eat rice and digest right, he is capable of doing yoga. That's a simple definition that's given. Who can do yoga?
Yes, yes.
So anyone who can eat rice and digest it can do yoga. That's the explanation for who's all eligible. So it covers everyone. Very good, very good, sir.
Thank you
So
so much, sir.
thank you, sir. Then,
we will go with the closing part. So you are having any questions, doubts? So in the chat you can see as a homework you need as a homework. So we will provide that. So we are happy to end this.
Please.
thank you very much for giving us the opportunity. We as a team in Sri Yoga Center did this presentation for the enlightened crowd of people in all scientists and lecturers and professors and assistant professors across India. A good number of people had come. We are very happy. It's been enlightening. I especially thank the organizers for including yoga and yoga therapy as a holistic wellness in this session. And I thank once again Ashwin, Sujata, who have been. Ashwin is a student of yoga, is doing his masters in US and that means now in Chennai. Sujata has been a yoga teacher in our schools in Chennai. Renuka is running a center for the past 20 years and Vijay Priya for the past 22 years. So all the best to all of them and thank you very much, sir. Thank you, madam, and all people who have been enlightening us with questions. We also feel enlightened in attending this session and answering your questions. Thank you.
Thank you, ma'am and sir. I'd like to express our deep appreciation to Ashwin, Dr. Anand, Renuka, Sujata, and Vijayapriya for sharing such rich insights and expertise with us. Your session has been both informative and inspiring, and we're all grateful for the time and effort you invested in being with us today. Thank you, one and all. So, I also thank all the participants for their active involvement in the successful completion of day two of the program. You shared insightful knowledge. I hope many more will follow, and I request the same strength to enrich all subsequent sessions together. Thank you, one and all. We'll meet tomorrow.
So we will log out. Thank you all.